everyone. I'm Cheryl Dalton-Norman, president of Conduit Health Partners with Industry Insights with Cheryl. I am so excited about my guest today. My friend Judson Ivy, who is founder, president, and CEO of Ensemble Health Partners, is joining me today. Welcome, Judson.
Thanks, Cheryl. Good to be here and good to see you.
Good to see you too. I would love for folks to learn a little bit about you and a little bit about Ensemble and the great work that you all do. Can you tell us a little bit about how Ensemble came to be?
Yeah, sure. You've heard this story. But for those that hadn't, I had worked in big for-profit healthcare for most of my career for 15, 16 years. That's where I met you. And one day in 2014, I had an idea of creating a revenue cycle company that would help health systems improve their margin and become more efficient. And so Ensemble was really a brainchild of mine that I had an idea and took the risk of starting a company. And we joke about it today. It started in my laundry room, and I think the legal documents were on LegalZoom.com.
That is so amazing. I love it. And then you've just grown it to be really one of the foremost revenue cycle management companies in the nation. And I am so impressed and really honored to get to work with you. And so I really feel like healthcare executives could learn a lot from our conversation today. And I think often when we think about revenue cycle management companies, we think about the financial aspects, billing and all of those kinds of things, which are critically important, not to financial significance at all. But when I think about revenue cycle management, and I'm a nurse, I think about it as doing the right thing for patients, for their experience, and ultimately for their safety. Could you talk a little bit about how revenue cycle management should really be impacting patient experience and safety?
Yeah. Well, Cheryl, a little bit, you mentioned our growth. Today, we have the privilege of serving a little bit more than 250 hospitals and 9,000 care providers as part of those hospitals. And so our work is really to enable them to do great clinical care and make it easier for physicians and caretakers to provide great care and not focused on the administrative burden. You keep up with the same data I do. Clinicians are being taxed and burdened to, spend a lot of time doing paperwork, and that all takes away from patient care. And so, although as revenue cycle, we're not administering medications and we're not saving people's lives, I do think it's really important that we are making it easier for physician and caretakers to practice medicine and to take care of patients and taking that burden off of them. And then last but not least, the clinicians didn't go to school to do CBTs and HCPCS and ICD-9s, and it's extraordinarily ICD-10s these days. It's extraordinarily complicated. And so our whole purpose of Ensemble is to make health systems more efficient in revenue cycle and make it easier for patients to access care and providers easier for them to practice medicine.
Yeah. And I think too about your teams that I've interacted with personally. So as I'm scheduling an imaging exam, or as I am receiving and trying to understand my bill and how insurance is paying,
Yeah.
having someone who treats me incredibly well during that process helps me to want to continue to engage with that health system. And I think what I've seen and experienced is that your team does that really well. And for me, I think healthcare executives really need to consider who is doing this and how it is managed, because often your teams or other revenue cycle teams are the people that we're interacting with the most pre and post stay.
Yeah, you are absolutely correct. That's why we employ an entire department around patient experience, is that a patient can have excellent clinical care and clinical outcomes in a health system But the lasting impression may be that messed up bill that they get, or the interaction they have with a scheduler or customer service. And those are lasting impressions. They will always have a positive reference to their physician, but the perception is certainly of the health system influenced by what is that experience. And so, as part of kind of our foundational beliefs in Ensemble, yes, as you mentioned, the blocking and tackling are table stakes of revenue cycle. Yes, you've got to do a good job getting the bill out and coding and billing, but what is also should be table stakes is how we care for those patients and their experience. And that sounds good, but the reality is health systems are under a tremendous amount of pressure to take business outside of the health system. So is that ambulatory surgery centers? Is it United Healthcare becoming the largest employer of physicians? Is it freestanding emergency rooms? People are trying to redirect patients outside of the four walls. So our job as RevCycle is to make it an easy and as pleasurable experience as possible administratively for someone to come to a health system. And I think if we don't start thinking like that, as the experience should be more hotel-like as the administrative process than hospital-like, we're going to struggle to lose business, and health systems are to environments that do make it easy, whether it's ASCs or freestanding community centers, et cetera. Patients are going to go, time is of value where they get the least friction and where they don't believe they're compromising care quality. Just say an MRI machine. A patient presumes they're going to get great care just because they're going to get an MRI. They don't ask if it's 120 slice, et cetera. But what makes them have that impression of how that went is how are they treated along the way. So I 100% agree with you. Revenue cycle is more than a blocking and tackling. It has to be how we make people feel, and to wrap that around the exit clinical care.
That's awesome. That's awesome. You know, a lot of talk and buzz right now is around AI and other kinds of technologies that I'm sure will be impacting and may already be impacting revenue cycle management. What do you see as the next big thing or the current big thing that is occurring within revenue cycle management?
Yeah, I think AI is a tremendous opportunity. And I tell my team, it's like the industrial revolution happening again for revenue cycle. However, it's uncharted waters in the sense that the reason why GPT-4 works to write a job description on the internet is because there's been millions of job descriptions uploaded to the internet over time. What has not been done over time is patients' medical records have never been uploaded to the internet, and therefore we're on the early stages of training these technologies, GPT-4, et cetera, about how to use medical record and patient-sensitive data. And so I think although it represents a tremendous opportunity for automation, for better experiences for patients to get their questions answered sooner, to help our staff give more accurate answers, is uncharted waters that I'm very excited about. But I tell health systems, and my advice to them is don't go at this alone. An AI journey on your own is limited to your own data set. The thing that makes generative AI and GPT-4, if you've used it, makes it powerful is that because it has lots of data. And so what I'm trying to share is our Ensemble vision, which is providers, we need to have scale, in which we do, in order to make sure that data is fine-tuned.
Yeah, that makes a lot of sense. And sometimes I see healthcare executives that I work with going, you know, we've got smart people. We know how to do this. We can do this for ourselves.
Yeah.
And I think that can be an easy trap to fall in and not think about, but what if I had the knowledge and the experience from organizations across the country that fed our best practices, that really enabled those, and someone to walk alongside me in doing this work. I think that's really important.
I do too. And I think it's not a matter of, yes, everybody has smart people. Yes, everybody has determination to support the mission of their organization. So those two things are a given. The question I rather reflect on is it the highest and best use of your time as an organization to be doing these revenue cycle functions or other non-core functions to clinical care? So should you be doing it is the question, not can you, because yes, your smart people can do it. And then two, what does scale bring to you that you don't have on your own? And to the extent that scale and those learnings from other providers and big data sets and leverage of scale, because the payers have lots of scale. There are 5 major payers in this country. And so as providers, I think we need to always be thinking about what is the highest and best use of our time of taking care of patients. And then secondarily, how are we going to compete for the good of healthcare against payers and sometimes we have to work together and share the data insights and learn from each other's learnings instead of saying, I want to build my own.
Yeah, I think that's very well said. Judson, as you look at the future of healthcare in the next 5 to 10 years, what do you see as the biggest risks, and what would you advise a healthcare executive to ensure the long-term success of their organization?
Yeah. I've been in revenue cycle for 25 years, and I remember the advent of APCs, and you probably remember the same thing, Cheryl. We thought our world was raining down so much change on us just when APCs came out. I think this business of taking care of patients is a hard business. It's extraordinarily rewarding for the work we do in our communities and taking care of people. But I think the headwinds against healthcare are tremendous. The inflation, the rising cost of supplies and labor. And, I am all for trying to bring payer and provider together. However, there's not an aligned incentives to do that today. And so the headwinds by payers against providers are tremendous. I think as we work towards value-based, there's more alignment, but today, 85% of the payments made in this country are fee for service. And so I think those headwinds of inflation, of payer headwinds, and then it's just our own competition and evolution of the healthcare environment itself. Patients are choosing different ways to consume healthcare today. Digital and virtual, if you had asked us 5 years ago how many visits would be digital or virtual, we would have probably said 2%. So I think the ways in which consumers and patients are selecting healthcare are different. And those represent a lot of opportunities for us as an industry, but also some challenges that force us to think out of the bricks and mortar approach that we may have done. And so, and with respect to revenue cycle, the headwinds are tremendous. And I say to our customers, let me focus on that. Let me focus on what the payers are doing wrong. Let me focus on data insights. Let me focus on how to make the patient experience easier administratively, while you focus on all the other stuff that are challenging for health systems.
Yeah, because there's plenty to worry about, and to have a partner who is helping you through that process is really huge. Judson, what have I not asked you that I should ask you?
Well, I think you've done a great job, Cheryl. So I don't have a lot that you shouldn't have asked, but that you should have asked me. I think the questions you've asked are really pointed about what are the challenges, and this work is so rewarding that we do and that providers do. But admittedly, there's some challenges. But I think lots of exciting things going on now, and I look forward to catching up with you in the future to reflect back on. If we pull this video up in 5 years, Cheryl, what will we say? Were we right, or how did it turn out?
Yeah, absolutely. Well, Judson, thank you so much for being here with me today. Always fun to see you, and I look forward to talking to you again real soon.
Thanks, Cheryl.